Years of waiting. But Balkis has at last got an appointment for heart surgery she needed when she was 6 months old.
2 years ago, we had an appointment with the Afghanistan Red Crescent to discuss the operation. Finally, it was our turn. Poor Balkis, she suffered a lot, and we didn't know that she had a hole in her heart.
Inside the operating theatre, doctors make final preparations. They are working on closing a large opening between the ventricles of Balkis' heart. But medical teams like this are under pressure in Afghanistan. They face heavy workloads after more than half of the paediatric cardiologists left the country following the collapse of the previous government. Balki's surgery is completed, but 11,000 children like her are stuck on waiting lists. This is due to a shortage of medical staff and a lack of resources in the face of sanctions imposed by the United States. Dr. KHYBER SIDDIQUI is one of 3 cardiologists who've remained in Afghanistan. He performs about 60 surgeries a month.
We have almost 23,000 patients on the waiting list. Practically speaking, the patients who wants to come to these hospitals, our hospitals, inside the country hospitals, for operations which we do, and as in our level, there are almost 12,000 patients who are waiting for us. But we operate around 35 to 40 patients per month.
The Afghan Ministry of Health says the country has lost up to 70% of its doctors, not only cardiologists, but those from other specialties.
The previous regime did nothing during the past 20 years. They did not build any health centres or hospitals for children who suffer from heart disease. As for us, we have opened a special department in the Children's Hospital which will soon provide its services.
ZAINAB Khan has 2 holes in her heart. She hopes it won't take too long before she gets her turn.
We knew about my daughter's problem when she was 40 days old. We have been told the operation will cost $4,000. Of course, this is a scary amount that I do not have, so I turned to the Red Crescent for help, and I'm waiting for my turn.
About 25% of patients with congenital heart defect need surgery, and spending too long on a waiting list means many won't survive.